If you've been scrolling through endless options for a pressure relief mattress and still feel stuck, you're not alone. It's easy to get lost in the hype of clinical-grade claims and wonder whether any of them actually live up to the promises when you're dealing with a loved one who spends most of the day in bed. That hesitation is exactly why I'm breaking down the Drive Medical Med-Aire Low Air Loss Mattress System today, so you can walk away knowing if this is the right fit for your situation. Link is in the description if you want to check the product details on Amazon. First off, let's talk about what a lower loss mattress actually does. The core idea is simple. A thin layer of air circulates constantly through tiny perforations in the surface, pulling moisture away from the skin and redistributing pressure points. For people who are bedridden, that steady airflow can be the difference between waking up with a fresh complexion and waking up with a painful sore. That's the headline benefit, but the day-to-day experience is where the rubber meets the road. I've spent the last couple of weeks looking at how caregivers and home health professionals talk about these systems. The consensus is that the real value shows up when the mattress is used for at least a few weeks straight, not just as a one-night test. In a typical home setting, the mattress sits on top of a standard hospital-sized bed, which is why the 84 by 36-inch dimensions matter. It covers the whole sleeping surface without having to tuck in extra edges. The design is built to be a plug-and-play solution, meaning the air pump comes integrated and the whole unit can be set up in under 10 minutes. That convenience is a huge win for anyone who isn't a professional nurse but still wants to avoid a complicated installation. Now, who should actually consider buying the Med-Aire? If you're caring for a family member with limited mobility, think spinal cord injuries, advanced arthritis, or post-surgical recovery, the constant low airflow can help keep skin integrity intact. It also works well for patients with conditions that cause excessive sweating, because the airflow removes moisture before it can soak the bedding. Home health agencies often recommend a system like this for patients transitioning from a hospital to a home environment because it mimics the pressure relief technology they already received in the clinic, but without the need for a full-size ICU bed. On the flip side, if you're just looking for a lightweight camping pad or a cheap guest room upgrade, you'll probably want to pass. The Drive Medical System isn't built for portability. The mattress and its pump weigh enough to make a single person think twice about moving it around the house. Also, the system needs a constant electrical outlet to keep the pump running. In a small apartment where plug space is at a premium, that could become a nuisance. And while the vinyl surface is labeled as durable, it does require regular cleaning with non-abrasive solutions to keep it from yellowing over time, something you might not want to deal with if you're only using it sporadically. Let's dig into the practical strengths that set this mattress apart from a regular foam topper. First, the lower loss technology actively manages moisture. In the real world, that translates to fewer mattress-related skin irritations. I read a few case notes from home care nurses who said the patients using this system saw a noticeable drop in the number of stage eye pressure points after just a week. The constant airflow also helps with temperature regulation. People who tend to overheat at night often report feeling cooler because the moving air prevents heat from building up under the body. That's a subtle but appreciated benefit, especially for seniors who can't easily adjust blankets. Second, the convenient design isn't just a marketing phrase. The unit comes with an integrated pump that has a single button for inflation and deflation and an audible alarm that lets you know if the air pressure drops unexpectedly. That safety feature is useful when you're not in the room 24/7. You'll get a heads up if the mattress starts losing pressure, which could indicate a puncture or a pump malfunction. The mattress also includes a quick release valve, so you can deflate it entirely for storage without wrestling with hoses. Third, durability is more than just it looks tough. The vinyl covering is reinforced at the seams, and the material is resistant to tears and punctures caused by everyday use. In a home environment where pets or kids might accidentally bump the side, that extra reinforcement can save you from having to replace the whole unit. The manufacturer's specifications note a weight capacity that comfortably exceeds the average adult, so you won't have to worry about sagging even if the user is on the heavier side. No product is perfect, and the Med-Aire does have some drawbacks that are worth mentioning before you decide. The most common complaint I've seen is that the pump can be a bit noisy when it's running. It's not a loud industrial sound, but it's definitely audible from across the room, which could be distracting for light sleepers. The